Hi, everybody. I'm Jocelyn Momenta.
And I'm Connecticut's healthcare advocate, Vicki Veltri.
And Vicki, we're here to talk about terms, definitions, and facts about insurance. Let's start off talking about PCP. What exactly is that?
PCP is a term that people use to describe either a primary care provider, which I think is probably the term people use it mostly for these days, or a primary care physician. I think primary care provider is the one people use most these days because we have more than just physicians, obviously.
And you must choose one, right?
You must choose one. Many plans, most plans, particularly HMOs, require that you select a primary care provider, and that's to do a couple things. One is to make sure your care is coordinated, but also to have you get, if you need a specialty type service, so that you can get a referral out to a specialist.
Now, do we generally have your doctor or hospital as part of the plan's provider network?
Yeah, so one of the biggest decision points for a lot of people when they pick a plan is whether or not the provider they go to, or providers, I should say, many people use more than one, is in the insurance company's provider network.
Because it may not be.
Right, and they may not be. And that is really an important decision for a lot of people, particularly people who use a lot of services. Because when a provider is not in network, it can trigger a lot more healthcare costs. So one of the ways we figure this out for people, and we tell people to, if they want to do it on their own, is to go to an insurance company's website that you're interested in. They all have their provider networks online, and you can see them. You can also get in a written one if you need to.
Well, you just referred to the in-network. Right. What exactly is in-network or outside a network?
Yeah, so those are important distinctions, very important distinctions, because when you see a provider and they're in your network, in the carrier's network, your insurance company's network, that undoubtedly means you are paying less out of pocket to see that provider. If you go out of network, you're going to pay more. And that's because the insurance company doesn't have a contract with that provider. So they're going to have to pay the provider more to see you. And as a consequence, you're going to have to pay more to that provider.
So that's in general. If they're out of network,
that's a general
you pay
rule.
A little higher.
That's true.
Okay.
And it can be anything from a little bit to a lot. And the reason I say that is a lot of insurance plans now offer people the ability to go out of network and see providers, and the insurance company will pay for some of that. But they will not pay the whole cost of that like they would in network. So you would still be facing significant amount of cost sharing for that kind of visit.
Okay, what about co-payments?
So co-payments, think of co-payments as sort of the price of admission, so to speak, of seeing a provider or picking up a prescription drug or going to a physical therapist. In order to get the service, you have to pay a portion of it up front. That's what a copayment is. So every time you go to your PCP, if you go to a specialist, you pay. Again, when you pay a prescription drug, you pay a certain dollar amount, and it may vary depending on the kind of service it is, and the provider gets the rest of it from the insurance company.
We hear a lot about deductibles.
Yeah. Yep, deductibles. Deductibles, most people understand deductibles when they think of their auto insurance, so it's an easy way to analogize to healthcare. So a deductible is something that you have to pay out of pocket before the insurance company will pay. So for instance, if you have a $500 deductible for the hospital, you have to pay $500 out of your own pocket, then the insurance company will pay whatever it is obligated to pay of the balance. That's how a deductible works. But interesting thing about deductibles is these days you may have a deductible for different things in your policy. So it used to be you would have one deductible. Now you may have a deductible for prescription drugs, and you may have one for your hospital care. So you really need to pay attention to that when you're picking a plan, what deductibles might be there.
You mentioned out-of-pocket expenses. Is there a maximum?
Yeah, so every policy that is written has an out-of-pocket maximum associated with it. And what that means is if you combine the costs that you're paying out of pocket, with the exception of what you have to pay every month, which is your premium to have a policy, when you get to what's called the out-of-pocket maximum, you don't have to pay any more out of pocket. Then the insurance company will pay the rest. So, for instance, a lot of policies have $2,000 out-of-pocket maximum. If you reach $2,000, once you hit that $2,000, no matter how you hit it, you're not obligated to pay anything more over that $2,000. So that's what the maximum is.
Okay. And what is co-insurance?
So co-insurance is when you have to pay a share of the cost of your visit. It's slightly different than a co-payment. A co-payment is something you pay every time. It's sort of a fixed cost. coinsurance is something that is a tool that has been used to try to lower some of the healthcare costs that people face. Generally, if you want your premium to be lower, you're going to be facing some costs, some coinsurance. So that is, when you think about the way we used to have insurance, where you would go to a doctor and let's say it would be 80-20. So the insurance company would pay 80%, you'd pay 20%. That's what coinsurance is. You're paying a part of the insurance coverage yourself. So it could be 80-20, 50-50, 70-30, really depends on the policy.
And most of them are.
Yes, and these days there's a lot of coinsurance and insurance policies. But very important thing to remember with coinsurance, kind of technical but important, is that when there's coinsurance involved, the percentage the insurance company pays is the percentage of what they would reimburse the provider. Not the reimburse, it is not, they're not paying a percentage of what the provider actually charges, which is more than what the carrier reimburses. So it's important to keep that in mind.
Okay, emergency room visits, we all know we're going to get there
Yeah.
sometime during that year.
Yeah, so emergency visits, so a lot of times what's happening is unless you have a true emergency, you're having to pay a fee for that. And that's an incentive to keep people from not going to the emergency department unless they absolutely have an emergency. But it's also a way to keep costs down, right? So you have to really examine your policy too to see whether you have an emergency department cost sharing requirement. Lots of people, some policies still have the allowable situation where if you go into the ED and you're ultimately admitted, that charge would be waived for you. Some policies do not waive that charge, so it's important to keep that in mind when you're looking
Mine
at
has
policies.
a co-payment.
Yes.
I have
That's right.
to pay a certain amount.
A lot of them are about $500 these days, yes.
Well, let's talk about hospitalization and major medical expenses. What's covered?
So for hospitals, what you really have to keep in mind, there's separate fees with hospitals. There's a room and board component, right? For when you're in a hospital, if you're there for longer than a day, you're paying a room and board fee. Then there may be a facility charge for the hospital, and then there's the actual cost of the procedures. Most policies cover all of these, but at varying rates. So some policies will cover 100% after you reach a deductible. Some are 80-20 after you reach a deductible. But all hospitals cover hospital expenditures to varying degrees.
Okay, and what about the health savings account? What is that about?
So the idea behind the health savings account was these were a creature of the federal government designed to help people defray the costs of their health insurance. So these are accounts that are set up that allow employers or people to save money in them, their accounts, which you can take with you when you leave an employer, to save money on a pre-tax basis, meaning you're not paying taxes on the income that goes in there, to allow you to defray, let's say, a deductible. So you may have a $1,000 deductible on your policy, but if you have a health savings account and you're saving money in there, you can use your health savings account to defray that deductible, to pay it off for you using pre-tax dollars. So it's a way to incentivize people to save money to pay for their health care and to allow employers to actually help their employees pay the cost of their health care.
But if you don't use it?
Well, it depends. There's different kinds of accounts. So health savings accounts, there's more than one type. Health savings accounts can be portable. You can take them with you when you go to another employer.
And some?
Some do not.
Right.
And some, if you don't spend them,
You lose
by the
it.
end of the year, you lose it.
That's what I
So
thought.
you really have to check and make sure the kind of account you have, that you're allowed to either take it with you or not. So
Right.
you have to use it the right way.
Let's talk about some of the limitations to things such as pre-existing conditions.
Right. So pre-existing conditions, very complicated, theme or topic. Pre-existing conditions right now, if you are somebody who has one, hard to buy a policy. If you're an adult, if you're a child, can't be discriminated against. Pre-existing conditions are complicated when it comes to transferring, when you move from job to job. That's when pre-existing conditions become most complicated. But as a result of HIPAA, the law that most people associate with privacy concerns, those kinds of restrictions on moving from job to job with pre-existing conditions have largely gone away, and the Affordable Care Act eliminates most of those the restrictions on policies for pre-existing conditions.
It's been a good thing under
It's
the
been a great
Affordable
thing.
Care Act.
It's one of the best things, in my opinion, probably the best thing to come out of the Affordable Care Act is guaranteed the right to get an insurance policy even if you have a pre-existing condition.
All right, where can people go for even more information and help? You have a phone number,
Well,
right?
people can come to OHA for help. We offer help 7 days a week. We have 24/7 coverage in our office.
You have a toll-free number?
The toll-free number is 1-866-466-4446. We do speak both Spanish and English. We're here to help you whenever you have a healthcare question. So I encourage you to call us at any point when you need our help. Thank you.
We also have an online.
And we do,
way
yes, actually,
to
we
get
do
on
have an
there.
online presence. Our website is at ct.gov/OHA. There you can find some easy to understand, helpful information for you, and also our phone number again if you need it.
Excellent. Thank you for watching.